So our patient is here for number 30 extraction, and they were also sent to the oral surgery room to make sure that everything was fine, and that's the mandibular first molar. As you can see here, we are looking at their medical and past dental history. Their medical, the pulse, blood pressure, respiratory rate, and temperature are all within normal limits, which means that they are capable of getting this extraction. And we're going to be doing it and performing the extraction in the clinic room. They are classified as ASA class 1, and class 1 and 2 technically are that you can work on them.
Yes, my name is Dr. Steve. How are you feeling today?
I'm feeling okay. I have a lot of pain in that one tooth, like on my lower, so that's why I'm here today.
All right. Have you ever had an extraction before?
No, I've never had an extraction, but I have gone to the dentist for other work before.
Are you feeling nervous?
Yeah, I'm a little nervous. I'm not really sure what's gonna go on. Not sure if I want to know.
Okay. Well, it's not that bad of a process. I'll go over it right now.
Okay.
All right. So some of the risks or post-operative things that are going to happen with you is there might be some pain, some swelling, bleeding, but it's nothing to be worried about. It's pretty normal for this kind of operation or treatment. If you have any kind of pain, you can always take over-the-counter meds. Those will work fine. If it's a little more painful than you can tolerate, then we can always prescribe something. It's usually for like 2 or 3 days, maybe a few more, plus or minus 2, but everything will be fine after that.
Okay, and is there any way that I can not get the extraction? Like, what would be the consequences?
Well, we could do that, but I wouldn't recommend it because from that, you could get an infection or there would be a lot more pain. And then leaving it really just wouldn't be the ideal thing for you to do because the tooth is pretty broken over there.
Okay, so I guess I'm ready, and I'll sign anything that you need me to.
Yeah, we just have we have to sign the consent, and then I'll even give you a mirror. You can check it out for yourself, and we'll be good to go.
Okay,
Thank you for providing that information. I do agree I should get then my tooth extracted. I don't want it to cause problems in the future. So I'm just going to sign here providing consent that I do want my tooth number 30, which is the right mandibular first molar, extracted. Thank you.
Tooth extraction, we're going to start by placing the patient in the chair and reclining at 30 degrees. This will reduce fainting and syncope, which will make it more comfortable for us and the patient themselves. So after we seat them, we're going to take vital signs. We want to take blood pressure, temperature, and respiration and heart rate. After doing so, we're going to, taking the anesthetic, we'll approach from the contralateral premolar, and we're going to look for the coronary notch, and we're going to inject into the raphe. We're going to pull back slowly to make sure we don't have any aspiration, and then we will slowly inject there. If we do this incorrectly, we can have some complications. We can have systemic toxicity. We can have nerve damage or muscle damage, which will cause soreness and pain. After doing the inferior alveolar nerve block, we're going to then do the long buckle, which is approached at a 45-degree angle to the tooth membrane. In order to check that the patient is numb and she won't feel anything during the procedure, we're going to check the lips on the side where we're doing the extraction and where we injected to make sure that she doesn't feel anything. And if she's completely numb, we're good to go.
So I'll be discussing the armamentarium. This is the bite block for the mouth of the patient for support. This is the 4x4 gauze that we're going to be using as a mouth screen or a throat screen protection to prevent from aspiration or swallowing any dental particles. This is the periostal elevator, which we're using to reflect the soft tissue and release the periodontal ligaments from around the tissue of the tooth. This is a small straight elevator, and the large elevator that we're going to use to elevate the tooth. This is the Minnesota tooth retractor that we use to retract the cheek on the side of the teeth that we're working on. This is the mandibular forceps that we're using to luxate and rotate the tooth out of the socket. This is the double-ended curé that we're using to debride the socket of any granulation tissue or tooth particles. This one is the saline wash that we're going to use to remove any of the debris that's free. And we're using a cup then to hold the saline solution, and then we use gauze at the end to control any bleeding, and we take out the bite block.
Okay, to begin the procedure, since we're working on tooth 30, we're going to work on the right side. We're going to first place a bite block to stabilize the jaw. Afterwards, we're going to place some throat screen and gauze so that the patient doesn't aspirate any materials or instruments or leftover tooth structure or anything like that. First instrument we're going to use is the periosteal elevator. We're going to go 360 degrees around the tooth with a finger rest holding in a pen grasp. So we're going to use a cheek retractor to make the procedure easier and make sure that the patient's cheek doesn't get stuck or anything. We're going to use the small elevator. We're going to come in using the serrated edges and we're going to place that on the tooth, starting from the mesial and working against resistance. We're going to do the same with distal. And then once the resistance lets up, we're going to switch to the wide elevator and do the same from mesial to distal. So the elevators are used to expand the buccal and lingual areas. Next we'll use the universal mandibular forceps on the mesial, lingual, and buccal as apically as possible in a figure 8 movement. This will luxate and remove any large chunks of the tooth. We're going to next use the double-edged curette, which will clean out any small debris that's still left in it, followed by any saline or Paradex, which can clean out anything too small that we cannot see. After the procedure is completed, we want to remove the throat screen and place gauze into the pocket to ensure that we have hemostasis. During the procedure, we could have some fractures of the buccal plate where we want to put them back in place, or any other complications we want to take care of before we let the patient go.
So I'm going to give you some post-op instructions that you can receive at the front desk later. Pain will be normal, discomfort will be normal later. You can take ibuprofen or Motrin for that, it's fine. Bleeding will be normal. Right now it's okay, it'll start bleeding maybe 90 minutes after the procedure. The anesthesia will wear off by then. So just before the anesthesia wears off, you want to make sure you take the ibuprofen, okay? You want to avoid chewy foods, make sure to eat soft food, cold foods, avoid hot and spicy foods. Okay, so you're able to brush the area, but just make sure not to floss. Make sure when you do brush, don't scrub hard. So just make sure to take ibuprofen every 4 to 6 hours, and you're going to be numb in the area for now, so try to avoid give you extra gauze that you can use. Make sure you use an ice pack every 20 minutes, but make sure to take it off so that your face can go back to normal. So you're pretty healthy right now, so you won't need any antibiotics. If something does happen, I'll give you my number and you can call me, and then we can use to prescribe something.
Okay. And should I come back?
So talk to the receptionist in the front, and you can make your appointment for next week, and I will give you a call tonight to make sure everything's going.
Okay. Thank you so much.
Thank you. Hi, Jess. Hi, this is Dr. Sean. Oh, I'm just calling to make sure everything went well. So the bleeding has stopped, the numbness has gone away. Okay, have you been needing to take any meds? Okay. Okay, sounds good. Just make sure to ice it and take ibuprofen as I told you back in clinic. Do you have any other questions? Okay. Alright, I hope you feel better. I'll call you again tomorrow to check how everything's going. Okay. Alright. Bye-bye now.
Hi, Dr. Steven. How are you? I'm good, thank you. Yeah, I did have to take ibuprofen. I followed your instructions every 4 hours, and I am removing the ice pack, putting it back on. Yep. My face is a little swollen, but it's not much. But like you said, it's kind of early. Maybe I'll get more swollen within the next day or two. Yep. Everything seems to be going well. If anything changes, I'll give you a call. And thank you again for calling me. That was really nice of you. And I'll see you on our next appointment if nothing changes. Okay? Thank you so much. Bye.